it's now fantastic. Now we actually have newer molecules to target migraine treatments for migraine patients and adults. I think the considerations for children are children's brain are still growing and developing, so one has to really be careful about how we use these molecules in children. So a lot more needs to be done in terms of understanding what the biological effects in the brain are with these newer molecules. And number two, it is also possible that in children, there is a huge amount of placebo effect when it comes to medication, and that is shown in all the triptan trials, for example. So one needs to consider how we are going to measure outcomes in children. I think that's very key. And I think the science in this and the practice is actually lagging to what really is needed in terms of real world data. So some of the traditional outcome measures that we use for children, we will have to go back and relook at them again. So I think, is pain, absence of pain at 2 hours still the best measure in a child? And again, in terms of prophylaxis, is PedMIDAS as good as we are ever going to get? Or is there other ways of measuring? And I think other practical ways of measuring in real life would be, what is the participation like for this child in life? Is a child actually able to participate in life in general? And of course, education is a huge part of this child's life, which means that we need to have newer ways of measuring outcomes in children when it comes to migraine. And especially we now know that migraine can affect cognition in terms of the cognitive clouding that comes with it, which means that every time the child actually has a migraine attack, they are losing their ability to learn and absorb and things. So I think it has got a direct effect in the child. So in order to measure what we are doing is helping the child, we need slightly different way of measuring these things.